Hello, welcome to First Coast Living. I'm Mike Prangley, and you know, an idea following a tragedy has led to healing for many when they needed it most. Jordan is standing by to tell us more about this with Art with a Heart in Healthcare.
Having a creative outlet can be therapeutic, especially for people receiving medical treatment. Matthew Richards is the artist in residence with Art with a Heart in Healthcare. Welcome to First Coast Living.
Thank you.
I'm so excited to learn about this as well. So what would you say started this organization and why?
Art with a Heart was started by two cousins, Lori Guadagno and Lisa Ullman, in the wake of 9/11 to try to spread some joy in the hospital. And we've been there for almost 20 years now.
How would you say it helps the residents then?
It helps build a sense of normalcy and promotes relaxation and
It helps you too, probably, because you feel so good about helping them.
It does. It's a very rewarding job for sure, but it promotes relaxation in the hospital and provides people with a sense of control. A lot of times in the hospital, it's easy to start feeling like you don't have any options when people are coming in to, take your temperature and stuff. So
Right. So this kind of allows them to be creative as well. And you have been with them for 10 years. We were talking about some of the favorite paintings you've been able to do, because painting is your favorite medium with this, right? What has been the response with some of the patients?
They absolutely love it. We've actually had parents sometimes tell us after working with their children it's the first time they've smiled during their time at the hospital. Yeah.
Oh my gosh. Well, that's wonderful, but it's sad to hear, but it's so nice to know that you can bring that smile to them. Tell me, why do you think art is so important to have in a hospital versus even just doing the art? But why do you think it's to have it displayed? Why do you think that's a good idea?
I think healthcare facilities, they're very incredibly important, but sometimes they become a little sterile. Lots of white walls, and having the art or designing space. A lot of facilities around Jacksonville do that, like the new MD Anderson Cancer Center, the Mayo Clinic. They're very good at designing space and putting art that makes it feel less like an institution and more like a place where you can relax and get your treatments.
That's a great point. There's an Amazon wish list, right? If somebody wants to help donate, can you tell us some of the supplies on there?
We've got color pencils, markers. It's mostly things to fill our art to go bags, so we can use them to make art with the patients. We also do patient requests, and the art to go bags, once we give them the supplies, they're able to take them home. Sometimes it's the first time they've had art supplies of their own.
Oh wow. So if somebody does want to get involved with that, how can they get more information?
They can go to our website, awahih.org. They can check out our social media pages. We're on Facebook and Instagram, and we have a YouTube channel that we started during COVID as well.
Very cool. Well, thank you so much for joining us today. This is great organization, doing great things and putting smiles on people's faces who may be having not so great of a time. So thank you so much.
Thank you, Jordan.
Of course. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.